So as you can see, it's critical that we should know more about diabetes because 1 in 3 Americans will develop diabetic get diabetes by 2050. And the current data is 34.2 million people already have diabetes. And then, there is a category just below diabetes, the pre-diabetes, and that's 88 million. So if you do the math, that's massive. Do you want to comment on the incidence, Venkat?
Sure. I think, the as you alluded, Ranjan, the way the trend is not very good. I think it is an important disease. It's always been a very, very difficult disease to manage, very expensive for in terms of the healthcare resources that it takes up. But if the current trend continues, almost 1 in 3 Americans might end up having diabetes. And like you said, the pre-diabetes tends to be even bigger problem. Almost 1 in 2 might end up with pre-diabetes. So I think the big message there is to how it is the incidence or the prevalence of diabetes has doubled over the past 20 years, and how we need to really not only focus on managing diabetes but also preventing diabetes, wherein we understand the risk factors of diabetes. That includes pre-diabetes, so that gives us a very good opportunity to make a big impact earlier on, and then use our resources appropriately in management of this really difficult condition. Because if you look at the slide, it just does mention also about how their early death rate is almost 60% higher in patients with type 2 diabetes. The prescription costs are twice. So it's a very expensive disorder. It takes a toll on all aspects of the individual's mental and physical well-being. And the lifespan of many of these patients, once they develop complications like cardiovascular disease, stroke, kidney disease, uh, is reduced by almost 5 to 10 years if they don't control this deadly disease earlier on. And as we know, diabetes is the seventh leading cause of death, and it is a leading cause of blindness, kidney disease, and amputations in the United States. So we cannot emphasize enough how important it is.
So let's just introduce our audience to different types of diabetes. I know the type 2 diabetes is what we see in adults and more prevalent. About 90% plus diabetics are type 2, and type 1, a lot of our listeners know, is early onset. You get in your teen years. Um, and we're going to focus today, and because it's a big topic itself in type 1, so we don't have enough time. So we're going to focus today on type 2 diabetes primarily, which is the diabetes of adult onset, correct?
That's correct. So I think, like you mentioned, about 5 to 10% of patients tend to have type 1 diabetes, and 90 to 95% have type 2 diabetes. And type 1 diabetes being a unique disease in itself, that we don't have, although lifestyle and management of their diet and exercise is very important, taking insulin, which is mandatory in them. Type 2 diabetes tends to be more focused on lifestyle management, wherein you can
We'll
make an
come to
impact.
lifestyle later. I know that's
Right,
going to be the big part of our
right,
talk. So
right.
let's go into the pathophysiology a little bit. Let me bring
Sure.
the next slide up. All right. So, do you want to talk about the pathophysiology, how the healthy pancreas is? And by the way, folks, for uninitiated, the pancreas is the factory for the insulin, the islet cells there, and that's what this slide shows. Do you want to talk a little bit more about the left half of the slide, the healthy, the type 1, the type 2? Venkat?
Sure. So diabetes, as we know, is a disorder of energy metabolism, right? So when we try to utilize or the food we consume and convert to energy, and glucose tends to be the main source of energy. For the cells to be able to metabolize glucose, insulin is a key to for the entry of the glucose into the cells. And if the insulin production, which is lacking in type 1 diabetes, or there is insulin resistance due to a problem with the receptor or the post receptor, there seems to be a problem with glucose utilization. As you can see, the red those glucose molecules cannot enter the cells because either the insulin is lacking in those triangles, the purple triangles, or there is really some insulin resistance in type 2. So type 1 is where there is destruction of the pancreatic cells which produce insulin, and type 2 diabetes is where there is resistance to insulin at the level of the receptor or within the cell post receptor. So while these are the broad classifications and how we know, there is increasing interest on other types of diabetes, which is the type 1.5 diabetes.
Do you want to talk a little bit quickly about type one and a
Sure.
half? I know this is a little bit esoteric, but let's give something fun fact to the people who are listening.
Sure. I think it is important to know because so many of these patients are diagnosed as type 2 and they don't respond well and they are frustrated, they get on oral medications. And the key difference is that they have antibodies against their own pancreas. So they have combined features of both type 1 and type 2. They can look like a type 2, but they are not, they're having antibodies against their own pancreas, and they usually are 30, 35 years old or above, so definitely adults, and they sometimes can manage their diabetes without insulin. So that's what people, many of the providers and patients themselves think they have type 2, but over a period of time, their insulin production will decrease and they might need to get on insulin. So the important fact is to recognize that although they look like a type 2, they are not type 2s. A distinct form of diabetes is also called as LADA, wherein they are not type 1 immediately at that point in time of diagnosis, but they can quickly get into decay and everything. So this is a very interesting part of what we do is to identify these patients when they come to the clinic. They tend to be thin and they are not responding to medications and their A1Cs are high. So we check these antibodies in these patients and then start them on insulin or very, very quickly to make them feel better.